stage. So I'm pleased to once again, as Chair of Health Watch Warwickshire, present to you my annual report. Last year, I started by explaining that Health Watch Warwickshire, as well as many others, had experienced a year of changes. Well, I'm delighted to report that this year, we've experienced a more settled 12 months, despite, in the middle of the year, taking part in a competitive tender process for our contract renewal. I would like to take this opportunity to thank Chris and all the staff and volunteers and board directors for their hard work in securing Health Watch Warwickshire's new contract for 5 years plus a further 2. This achievement was a result of a fabulous team effort and, to me, a clear indication of the faith our commissioners have in Health Watch Warwickshire and the work that we do. We look forward to embracing the challenges and opportunities that health and social care will continue to present us for the next few years. On hearing the news that our tender application had been successful, Chris, our Chief Executive, said, "I'm proud of what we have achieved over the past 10 years. My thanks go to the people of Warwickshire, local, regional and national partners and Health Watch colleagues for their unfailing support." I, as Chair, can only echo Chris's words. I hope that by now you will have all had sight of our annual report for 2022-23, which is available from our website. In the report, I mentioned how important it is that Health Watch Warwickshire does not work in isolation. Working closely with other Health Watch organisations and Health Watch England enables us to share learning and influence decisions both nationally and locally. We are pleased to have a voice at the 3 local place boards: Health and Wellbeing Board, Care Collaboratives, Integrated Partnership Board, as well as other local meetings. This helps us to ensure that the voice of Warwickshire people is heard at every level. The work that our engagement and outreach officers carry out enables us to listen to your first-hand experiences of health and social care. We then seek to identify common themes and use this information to escalate to and help influence those that run our services. Whilst doing this, we strive to remain independent and impartial so that it is your voice that is heard, not ours. We are pleased that our enter and view visits to care homes have resumed. Our staff and volunteers who visit the homes provide helpful feedback to managers, helping them to improve the experience of residents, carers and their families. Last month, we held a very successful event in Rugby and welcomed over 110 delegates to Ben Hall to discuss state of care in Rugby. We are currently pulling together the findings from the event in the form of a presentation report, which will be made publicly available. I was pleased to be able to chair the event, but the real thanks must go to Adrian Canel-Parola for facilitating the day and the staff team with support from volunteers for their hard work in planning, arranging and supporting the event on the day. Recent surveys have included one on menopause, where we continue to get a good response from local people. This survey will remain open until the end of the year, and we will then feed back the findings to Warwickshire County Council's Menopause Task and Finish Group. Thank you to Caroline from the staff team for coordinating this important piece of work. In July, we completed a dental service survey in Rugby with 463 responses. Staff members Vina and Deb worked together to produce the final report, which has been sent to NHS England dental commissioners. Our adult social care report in April 2023 has been well received by Warwickshire County Council's adult social care team, and we are now jointly looking to bring about service improvements drawn from the report's findings. Following this, and due to some sterling work by staff member Robin, a very strong relationship and trust has developed between Health Watch Warwickshire and Warwickshire County Council's adult social care team. A Veterans Health Check project was last month accepted by the Integrated Care Board and will be taken forward by Carla, Tanisha and Deb, again from the staff team. Earlier this year, our organisational priorities for 23-24 were agreed. These are improving care over time by using our extended contract to work with providers and commissioners to bring about sustainable service improvements. Promoting continuous engagement by working with Coventry and Warwickshire Integrated Care System and others to replace short-term consultations and engagements with an approach which sees relationships and trust being at the heart of meaningful engagement. Further development and promotion of our Enter and View service so that we can continue to respond directly to concerns we hear from patients and the local community. Currently, the key issues we've identified from patient and public feedback are GP services, in particular, booking appointments and access to GPs, as well as communication, dentistry across access, especially access to services, hospitals, including quality of services and communication, as well as administration, which is described as largely poor. I would now like to end my report with a few words from our annual report, which was published earlier this year, where I said, so 2023 marks the 10th anniversary of Healthwatch, and I am proud of the difference we have helped to make to the lives of local people. This has been due to the hard work of the small team of staff and volunteers, but also, and most importantly, the people of Warwickshire for speaking up and sharing their views and experiences. Thank you for listening. There will be an opportunity for any questions at the end. I would now like to hand over to Chris on behalf of Mike Flaxman to present the financial report. Chris.
Thank you, Chair. And I'd like to echo your thanks to our volunteers, to our staff, to our board of directors who've worked extremely hard over the year, and of course to the people of Warwickshire for supporting Healthwatch. It's been a challenging year, but I think quite a rewarding one. The annual accounts are available to anybody who wants a copy. I'm very happy to send you a copy of those annual accounts if you wish to see them. But Mike Flaxman asked me just to point out one or two headlines. And I did want to thank Mike Flaxman, and in particular because he is a key part of the governance arrangements which have kept us financially stable for a decade and more, and which continues as we go forward to get us a projected path towards break even, and if not, slightly better than break even. So this year, in the last year, we had local authority funding of £227,065, roughly, and an additional income through contracts that we've secured with partners of £8,486, giving us a total income over the year of £235,551. On the other side of the balance sheet, we've had expenditure in terms of staff costs at £180,198 and operational costs of £51,817, giving us a total expenditure of £232,015. And I think this kind of precision is important because we do monitor very closely, because we do believe that financial stability is at the heart of a strong organisation. So this year we've managed, through the heroic efforts of staff, of Mike and others, to achieve a roughly break-even position. In fact, we've made a small operating surplus, which we are then able to apply to projects. And projects are a really important part of what Healthwatch does, because they are the work that we do, which is over and above that which we are contracted to do. So it is added value. So any small surplus we make is applied in that regard. As I say, Chair, if people want a full copy of the accounts, I am more than happy to send it to them straight after this meeting, and to pick up any more detailed questions that people might have about those accounts. Thank you, Chair.
Thank you, Chris. So we're now on to the time where if anyone has any questions, I will happily delegate to Chris for him to respond. Does anyone have any questions that they would like to ask?
Sorry, Chair, can I quickly interrupt? I do apologise. There is item 4, the appointment of auditors.
Oh, I do beg your pardon. It's because I've covered my my agenda up with my iPad. So I forget that. One day Health Watch will have a chair who knows what they're doing. Would you like to lead on the appointment of auditors then, please, Chris?
Yes, thank you, Chair. We already have a chair who knows what she's doing, so I think we're fine in that regard.
Thank you.
Michael Harwood and Company have been our auditors for the last year, and we have found what they have done to be more than satisfactory, and I would strongly recommend to the AGM the continued appointment of Michael Harwood and Co.
That's fine. I'm assuming if that's fine, I can see a show of hands from board directors that are here. Then that's fine. We're happy to take that recommendation, Chris. Is there any other business, Chris, before I move on to questions and answers?
No, I think we're fine on that one, Chair.
Right. If we can just go back, rewind the tape as we used to in the old-fashioned days. This is the opportunity now. If anyone has any questions or answers that they would like to ask of Health Watch Warwickshire, this is your opportunity. If you would like to, if you're able to actually do a Zoom hand, might be easier, because I can only see a number of you on my screen at this time. Does anyone have a question?
Judy Felt, I'm sorry, the cat's sitting right in the way of the. I'm struggling to find the hand. I have a question, please, Chair.
Yes, go ahead, Judy.
Well, it's a thank you actually, because I'm on the Task and Finish group about menopause at the County Council, and we've had lots of professionals, come in and tell us what there is out there, and there's more than we thought, but it's very patchy, very patchy. So it's something that needs to, the good work needs to be spread out, but we can't do it without the voice of the residents. And that's what you're doing for us. So thank you very much. I think we hope to report sometime in the new year. Certainly have the draft ready in the new year. But as ever, and Chris will know this, I always put the residents first and everything else follows on from there. We can't do a task and finish without the voice of the residents. So, and we also haven't got the staff in all the time to do the responses we need. So it's a thank you from the group really for helping us with this on a very important topic which people still don't talk about, and it needs to be something that's, we all, us ladies all go through it and the men all suffer through it as well. So it's a very important piece of work. So thank you and keep up the good work. I'm amazed you do so much on such a small budget, but
well, more money would always be gratefully received.
As I said, perhaps I shouldn't say that because you might want us to up the grant. So, yeah, thank you.
Thank you, Judy. And we do look forward to the outcome of that work, hopefully sometime in 2024, which isn't too far away from us now. Any other questions?
Yeah, Fiona Wilkinson has indicated chair, as has Robin Rumbles.
That's fine. If we take Fiona then first, please.
Okay, mine's, I don't know if it's relevant or irrelevant. How do you reach people who are not computer literate?
Chris?
Our engagement and outreach officers go to a lot of local community groups and meet with them face to face. And we also go to local events that have been put on, and we do have printed literature that we put out there. So we do make every effort, because we do understand that not everybody has IT access. We do understand that, and we do our level best. But of course, as has already been pointed out, there are not many of us. So it's actually quite difficult to get round everywhere.
I only say that because listening to the report, you've been going 10 years. I've only just this year heard about it. And I'm reasonably computer literate. I just wondered, do you know what? I'm in Stratford. I don't know if that makes a difference.
No, I don't think it does make a difference. I mean, I think the issue about public visibility is one that we've wrestled with for quite some time.
Okay, thank you.
That I think, no, I think it's a fair question. And in our view, I think Healthwatch England should be doing more to promote the visibility of local Healthwatch. They're in the position to do that. We will do what we can with very limited resources, but our national organisation, in my view, needs to do more to support that public visibility.
Thank you. Thank you for answering. It's just, as I say, I've only just discovered it and I'm sort of still at the point of looking at websites and things. So, you know, I'm not criticising, I'm just asking the question. Thank you.
Yeah.
No, and I think it's a valid point, Fiona, and Chris and I were at a Healthwatch England event. Don't know whether it's last month or September, my scale's gone. And it's something that we mentioned at that conference, because we are a small organisation and it is hard. And it's a bit like, for me, Healthwatch is one of those things that should always be visible. And we do try, but I think, as Chris said, it's the national voice so that people know nationally to look for their local Healthwatch if, you know, they have concerns with regards to health and care issues, or want to actually say that they've received good care as well. We happily take reports on both positive and negative, because it is also good to shout about those things that have gone well. Robin Rumbles, I believe you have your hand up. Robin.
Yeah, Chris, you mentioned that you had a small surplus and you spend that on specific projects. What sort of projects did you mean?
Yeah, we've got a number of reports on our website, Robin, about the projects that we've done. So we've done something around homelessness. We've done a few projects around carers and their requirements and needs. We've got the one at the moment, as I say, on we've done the dental survey in Rugby. So all of those things we fund where we need to from reserves. We run a fairly tight ship, and I am pretty stingy with the purse strings, I have to say. But we do actually go out, and we will only run a project if we satisfy a number of criteria. Firstly, we would have to be satisfied that a project makes a difference, that it's actually worth doing. We will also verify that nobody else could do it better, or nobody else is in a position to do it better. And the third criteria is it has to add value to what's already happening. So we satisfy all those criteria, and then we go out and do it. There's a really interesting report on our website about our work with people who are homeless. It's called the Rights Access Project. And I think if you have a quick look at that, you will see the sort of thing we do, Robin. And we're looking at 2 or 3 more now.
Thank you.
Okay, I have Stephen with his hand up.
It's Jackie, actually.
It's
Oh,
Jackie.
sorry. Yes.
I'm just coming back to Fiona's question about how do we, you know, make Healthwatch visible, not just to people who are don't have computers, but to everybody generally. And I think we did suffer a little bit during the COVID, because one of the places, you know, you could always put leaflets in doctor's surgeries and that sort of thing. But actually, people stopped being in doctor's surgeries and sitting around in waiting rooms. I know at our doctor's surgery that is not a big happening now. So at some places we weren't able to access because of the COVID. And I think as volunteers, we generally carry leaflets around with us. In actual fact, I could probably do with some more leaflets, and wherever we are, try to sort of advertise Healthwatch and say what we are and what we could do and how we could help, and that we also like to receive positive views about services, because that helps us as well as any of the problems and negative ones. So I think we do. I just wanted to get back to say we do try. I think we were hampered during the COVID, and some of the places where we could display our leaflets and things, we couldn't because of COVID. But I think volunteers generally do try their best to advertise COVID wherever they are. Thank you.
Thank you,
Yes,
Jackie. And for me, our volunteers do more than their best. We couldn't actually do it without them. And I'm going to hand over to another one, Dilys.
Just to add a comment about the difficulties for people who are not computer literate. As I think most people know, I'm a part-time carer for a relative with dementia. And so we have the problem there. And it isn't only a problem with health issues, it's a great problem for banks as well. So I think there's a lot of organisations that have, got to look at this and think about how it can be, how we can deal with it, because it's not easy. Yeah.
No, I agree, Dilys, and it's equally things like railway tickets and things like that now. Everything is going online.
Yes.
It's not easy. I appreciate that. Thank you, Dilys. Any other questions? I can't see any virtual hands. That's
I
me
think we
scrolling
have,
up and down.
I think, Chair, we have a question potentially in the chat. From
Right, so the question is, there's a lot of chatter on Nextdoor in Warwickshire about difficulty getting face-to-face appointment with GPs and also getting through on the phone to GP surgeries with large queues and then all the appointments gone before 10 a.m. Is Healthwatch looking at this, please? Chris?
Yes, it's an issue that's been coming through to us for some time now, and we have been raising it for some time now. I know Judy Falk has heard me say this before, about the difficulties that some people have in accessing GP services. Every time we do that, we get a slightly defensive reaction, I have to say. And they're saying it's not as bad as people say. But to my mind, there's one of the key objectives of the integrated care system is the reduction of health inequalities. And I think the ability to access either telephony or information technology is one cause of inequalities. And I think if the ICS really does need to take that seriously, because clearly for some people, the delays in getting GP appointments and other appointments through telephony and IT are adding to their levels of anxiety and stress and are actually making the whole patient experience and outcomes worse than they would otherwise have been. So I think some progress has been made. To be fair, some progress has been made, but I still think there's an awfully long way to go, and we will not stop raising the issue as long as I'm here, Chair.
Thank you. I hope that answered your question as much as we can, Fleur. It is something that we're aware of, and in my speech I did mention that it's one of the things that we hear a lot of noise about. Thank you. Anything else? No. Obviously, if you do have a question at all, please contact us, either by telephone, the old-fashioned way, if you actually see us at one of our face-to-face events, or obviously online as well. We'll happily answer any questions that you may have. As I said at the beginning, we will make sure that these minutes are put together and circulated, and they will also be available on our website. And I'm just seeing quickly what Tanisha's just put up there.
I've just added a link to our annual report, Chair.
Thank you very much, Tanisha. You're very organised.
Thank you.
If that's everything, please contact us if there is something you'd like to ask. And otherwise, thank you for joining us today, and enjoy the rest of the day. And where are we? Merry Christmas and a Happy New Year. Is that too early? That's too early, isn't it? Thank you, everybody. Please take care. And